Back now with our Power Roundtable, Bob Woodward of the Washington Post, syndicated columnist Kathleen Parker, and David Brooks of the New York Times. Well, Bob, your newspaper put on the front page this week what everybody has kind of been talking about in the corridors here, and that is things are not going very well in Afghanistan, and it looks like the commanders there are getting ready to ask for a substantial increase in American forces there. Now, you were there this summer. How's it going, and what do you think the chances are that we might put more troops in there?
I mean, the chances are always there. General Jones, who's the Obama National Security Advisor who speaks for the president, went and told the commanders in Afghanistan, let's address the strategy we have now of fixing the economy, building security, addressing the governing questions before we start asking for more troops. What's interesting, there's evidence now that the military is getting the message. They built a warfighting headquarters for General Rodriguez, who is General McChrystal's deputy there, and added hundreds of people, and normally it's an automatic, give us more staff. They actually took the new staff, hundreds of people, some from Europe, some from Afghanistan, without asking for more. So the Obama message is let's see if we can fix it with, or proceed with the strategy we've got. That doesn't mean no more troops in the future at some point, but it's a big focus, and it's significant that the military has acted that way so far.
But you came back and reported that the White House, General Jones, told the commanders there, we're not going to give you any more troops right now. But now we're getting these reports that the general's advisors and the general himself is actually considering, one source told me, doubling the U.S. forces in Afghanistan. Now, I think Congress is going to be very dubious of something like that, and as you reported, I think the White House will be dubious of that.
Sure, I mean, the president, this is now Obama's war, and he said, okay, I'm giving you 21,000 more troops, and and they told him, Bob Gates, the defense secretary, told him, he said, I hope I don't have to ask for more. So, we all live in a world of limited resources. No one knows that better than those of us in the newspaper and broadcast business. And the military realizes that too, and Gates in particular realizes you double the force, where do you get it? And then all of a sudden we look like an occupier in Afghanistan rather than somebody there to help.
Well, you were there earlier,
right,
David. What do you think is going on there? It does not appear to be going very well.
But we knew this would happen. I was there when they were formulating the policy, and they knew at the time that this summer would be awful as we sent Marines and other troops into Helmand and the other provinces. We knew this would be bloody, and it has been a bloody month, and the next month will probably be a more bloody month. But they knew it with the awareness that this would be a 5-year project. And to sort of flake out now, I think would just be a disaster. It would hurt the credibility of the president. And it's too soon to tell whether it's working or not. The second thing to be said, and this I do fault the administration on, was that there was a tension between the policy they sold and the policy they enacted. The policy they enacted is a pretty intense nation-building policy, village by village, street by street, with policemen, with agricultural reform, pretty intense. But they sold it as sort of a light footprint policy that we're actually not doing nation building. Well, they got to get one of those two things in line. Either we're going to do nation building, which is what the policy is, or we're not. And if they're going to do really nation building, they may require more troops. And whatever, I think the lesson of Iraq to me is make it work, whatever the troop levels are.
Do you think, Kathleen, that the American people understand the need to whatever it is we're trying to do in Afghanistan?
Whatever we're trying to do. Well, I think they understand that you can't just go in and make a mess and then walk out. And always Afghanistan was the acceptable war. Even those who opposed Iraq, including President Obama, felt that the war in Afghanistan was the good war. But we have other problems there on the ground, which includes the fact that we're losing the hearts and minds of the people. We have too many civilian casualties that are interfering. In sort of in the southern areas in our the border of Pakistan, we have a problem with you know, Pakistan's not helping us monitor that border. The Taliban can come and go at ease. That's where the poppy fields are. There are all sorts of complex issues on the ground that are going to take some very tough applications of new thinking, and I think the American people are going to have to understand that before they'll tolerate more troops.
Well, I brought this up first because I just think there's a big policy fight coming, and there's some really hard decisions that are going to have to be made, and we better start thinking about that. I mean, obviously, the economy, healthcare, and all of that is very important, but all of this seems to be happening kind of while the focus is on so many other things.
Yes, and President Obama has made it pretty clear he wants visible, sustainable progress in Afghanistan within 12 months or 18 months. And, you know, how do you measure that? They're talking about coming up with benchmarks like they did in Iraq. We still haven't seen them. Congress hasn't seen them. How do you go into this complex war, more complex in many ways than Iraq, because this is a poor country where they can't supply the money to build up their own force level. We're going to have to do that, or the Europeans, or somebody's going to have to do it. So maybe when the history of this is told, this is going to be the hard war, and Iraq is going to look easier.
The only thing I would add quickly on the upside is that our troops are a lot better. They really are impressive in that they know how to do this. Secondly, I found they like the Afghans more than the Iraqis. They work with them better, and so they're a lot more upbeat. I found them quite upbeat when I went there.
Let's talk about the other things, and that is health care. Congress has gone home now, at least the House has. Where are we on this, Kathleen? I'm not sure I know. You know, we've got all these plans floating around the House. The Energy Committee over there approved one. You know, various committees, so many different committees have pieces of this thing. I'm not sure I know where we are on health care. Do you think we're going to come out of this with a health care reform like the president wants?
You have an awful lot of company, Bob, because nobody knows where we are, including people on the Hill. If you ask anyone exactly where we are, they'll say, well, nobody really knows. And actually, that's going to help Congress as they are going back to their home turfs, because they can have plausible deniability by saying, well, we're not really sure yet. But, you know, people are we're canceling town halls because people are so angry, and you know the crowds have become a little raucous. Where we are, you know, the Senate group of 6, this bipartisan group of 3 Democrats and 3 Republicans, the Finance Committee, are working on a bipartisan approach, and they're real committed. There's an enormous amount of pressure on them to wrap it up quickly. In fact, a story ran last week saying that they were nearing completion, and they weren't. That was probably a plant by someone who wanted to apply a little more pressure. But in any case, they're committed, but there's a concern that there are forces stronger than those 6 individuals, and that there are plenty of people who really do want a partisan bill, and those forces could ultimately prevail.
But there may be an information gap here, too. People in the administration have said, acknowledged publicly, that we don't know in healthcare reform exactly what works and what doesn't work. And to go with a big reform proposal and legislation when you don't know what works and what doesn't work is very, very difficult. You know, Obama's made this point, and I think he's right. It's kind of follow the money. Where is the money? And he's saying there's too much waste in the system. If you go look at hospitals or clinics or doctors' organizations, you realize they're very much like the CIA. It's hard to figure out exactly what they're doing and what the costs and the tests are. Much is hidden, and I'm not sure the Obama administration or the Congress or the public or our business, the news business, really has taken this apart to say, look, this is where the costs are, this is where they can be cut.
Well, that's the part that I don't understand. I mean, you know, I've been around Washington so long, when I hear politicians say we can get this done by cutting waste, fraud, and abuse. Somehow waste, fraud, and abuse, it just never appears to winds up being enough of it to pay the bills. How are they going to pay for this, David?
Well, they can point to models, the Mayo Clinic, the Cleveland Clinic, that really do an efficient job. The problem is, as anybody who followed public policy knows, There's a big difference between finding an island of excellence and then building a national system based on that model of excellence. That's just two entirely different things. So what I think it's useful to do is look at the people who've proven themselves to be pretty good economists about all this. The people at the Congressional Budget Office, very impressive organization. And what they have found for the House bill, after this is all implemented, healthcare costs will be rising at 8% a year. It won't bend the cost curve down, it'll bend the cost curve up. That is just a huge problem. And Obama is very eloquent on this subject. Unless we get costs under control, we'll all be paying rising premiums, wages will be flat, the budget will be bankrupt on a federal level, and the bill doesn't do that. That's, to me, is the problem with this summer. They're selling a product that doesn't do one of the two tasks they set out for healthcare reform. And that's just a huge political problem, and I think why public opinion has moved in the wrong direction.
And that's exactly what President Clinton and his wife Hillary ran into in the 90s. The death of healthcare, of Hillary Care as it was called, was really the money. And it was actually in August of 1993, they gave President Clinton a series of decisions about health care, and he looked at it and he said, my God, costs are going to go up. And in fact, costs would not go down into what he jokingly referred to as the second Gore administration. As we know, there was not a second Gore administration, and that would have been 12 or 16 years from that moment. So you haven't solved the money problem. I think not just to the public or the Congress, but to themselves.
I wonder if the president learned too well the lessons of Hillary Care, a program that was developed in secret, dumped on the Congress, and it sank like a stone.
I think that's true.
So instead, he said, well, here are some general principles, and he left it to the Congress to find the answers to all of this. Don't you think, Kathleen, he's going to have to, in the end, get more specific on exactly what he wants, exactly how he intends to pay for it?
Well, yes, he's tried to do exactly the opposite. Everything the Clintons did, he did the opposite, and it's backfired on him a little bit, because now we've wound up with bills that don't really reflect what the president has said he wants. But go ahead, David. I'm sorry.
No. Well, I would just say there are three options. There's the Ira Magaziner hatch it in secret option. There's the hand it over to Congress option. But then there was another option available to him, which is there's a health care plan put together by Bob Dole and Howard Paker and Tom Daschle. And he could have said, okay, I'll sign up with that. And the American people could have said, well, I don't really understand health care, but I look at those guys, they probably know what they're doing. And he didn't take that up.